Get to know the very talented, caring, and dedicated providers at HSHS Medical Group, where we promise to offer patient-first care.
My current practice in plastic surgery is fairly broad-based. There's a lot of different parts of plastic surgery, but I basically focus on breast surgery, breast reconstruction, cosmetic surgery, and then treatment of skin cancers. I was born and raised in Pittsburgh, Pennsylvania. I grew up in a town outside of there called Penn Hills. And when you talk about how I made the decision to get into medicine, I remember exactly when it was. I was in 10th grade and knew I liked science and I wanted to be involved in it, but I didn't want to be in a lab with rats and test tubes. And I thought, well, medicine will be just a great thing to be able to still do all the science part of it, but interact with people instead of lab animals. The last 3 years of my medical school were a scholarship from the Navy. So when I finished at the University of Pittsburgh, I went and did my internship at Portsmouth Naval Hospital in Virginia. I spent a year on an aircraft carrier as a general surgeon, and then came back to Bethesda and did a few more years as a general surgeon before the Navy let me go, and I went and did a plastic surgery residency at the University of Cincinnati. That's where I met my wife. We went to Houston, Texas, and I did a fellowship in breast reconstruction with Mark Schusterman. I had 12 years in the Navy. That for me was kind of a break point about whether to stay in the Navy or leave. I had made the rank of full commander. I searched all around. I found a job in Aiken, South Carolina, and established myself there, and I practiced there for 21 years until I came here now for an employed position in Effingham. Patients get to my practice by having a specific concern. So that can be either cosmetic or an upcoming problem with cancer, or having had a previous cancer surgery where they need reconstruction. So cosmetic people obviously come with a specific concern, and we address that using multiple techniques. Sometimes it's superficial treatments, sometimes it's actually just surgery. If they're going to be a candidate for a mastectomy, they would potentially come and speak with me before they even have their mastectomy so that we could plan an immediate reconstruction. Some patients, if their cancer is more advanced, they have to wait until after their treatment is nearly completed before they can come back and have a reconstruction. That's called a delayed reconstruction. But those are kind of the two routes for that. In terms of skin and skin cancer, sometimes I'm seeing and diagnosing lesions and cutting them out and then repairing the defect. Other times dermatologists will refer patients to me where they've cut out a skin cancer and I repair the defect. I think the perception I'd like my patients to feel when they leave from that visit is I really care about what they're going through, and I understand how they might feel. It is a complex situation, particularly in breast reconstruction, where sometimes we're returning to the OR multiple times to do different phases of the reconstruction. I kind of enjoy it actually, because I really become a friend to my patients, and some of these reconstructions can take up to 9 months or a year to complete when you stage out all the different parts of it. What do I enjoy about medicine the most? I think it's really being able to help people and make them better. Plastic surgery, a lot of what we do sometimes is making something out of nothing. That fascinates me as well.
To schedule an appointment or learn more about the services offered by HSHS Medical Group, please visit our website,